Grows over the Social Health Authority's SHA overseas treatment package. The Ministry of Health and SHA have announced plans to review the benefits package to ensure all Kenyans have access to quality healthcare. Elizabeth Atieno reports that the SHA has also confirmed the existence of a specialized medical scheme for civil servants, while reiterating that all registered Kenyans enjoy equal benefits under the scheme.
It is 3 months since the Social Health Authority SHA was launched, and so far 18.2 million Kenyans have registered with the new health scheme. However, there exists some loopholes surrounding SHA that have seen some patients thrown into an abyss of despair and desperation. The Ministry of Health now acknowledging that indeed the benefits package under SHA needs to be reviewed to benefit all Kenyans.
The indication initially was that you are supposed to review the tariff and benefits after 2 years, but because of the call from Kenyans regarding their experience with SHA, that will be done much sooner.
Concerns have been rife on patients seeking services overseas being abandoned by the new health scheme, reason being that SHA's contribution to overseas treatment is capped at 500,000 Kenya shillings. This has left hundreds of patients in limbo, not forgetting the influx of patients seeking services abroad. For instance, between 2021 and 2022, a total of 569 patients were sent abroad for specialized care, with India accounting for over 80% of these referrals.
Just to emphasize that SHA is providing support in terms of foreign treatment by way of, based on the tariffs that we are using, meeting the cost to the tune of 500,000.
The 500,000 Kenya shillings being offered by SHA is not enough for some patients who need treatment abroad, considering that most of these patients are referred overseas for high-risk surgeries like open heart surgery, stem cells transplants, bone marrow transplants, liver transplant, and arterial switch operations. These treatments mostly cost approximately 1.5 million Kenya shillings, which means SHA can only cater for at least less than half the amount.
The Cabinet Secretary and the Principal Secretary, State Department of Medical Services, have instituted measures to be able to ensure that the benefit package tariffs advisory panel, which is envisioned in law, is then in place.
Another issue raised by Kenyans is that SHA appears to be discriminatory, whereby civil servants enjoy a better package compared to those working in the informal sector. In its defense, the Social Health Authority says the health scheme for civil servants has been transitioned from the defunct NHIF.
We have a separate scheme for civil servants, but the benefit I've talked about is available to all Kenyans who are registered under SHA. The benefit is uniform.
Since the inception of the Social Health Authority, 660,000 claims totaling to 14.6 billion have been lodged on the portal. 8.5 billion Kenya shillings for the private and faith-based facilities and 4.8 billion Kenya shillings for the public health facilities. The number of pre-authorizations has exceeded 300,000. Meanwhile, Kenya has now received 2.3 million doses of the BCG vaccine, and the distribution has commenced to the 9 regional depots, including Nairobi, Kisumu, Kakamega, Nakuru, Eldoret, Garissa, Mombasa, Meru, and Nyeri. An additional 234,000 doses are currently in stock. Elizabeth Atieno, TV 47, Nairobi.